Warning, censorship. Warning, censorship.
CBC is really not all that into private COVID testing and private COVID vaccination clinics. At least that was their position publicly, but behind closed doors, the bloated Mother Corp was looking at ways to test their staff and even vaccinate CBC staff. And the options they were looking at, well, they had little or no government involvement whatsoever.
The private COVID testing industry is booming. Many companies are only months old.
Who's doing the test? What are the standards? How do we know that they're doing it at the same sensitivity and specificity as that are done in provincial labs or hospital labs?
Companies offering COVID PCR tests must use qualified personnel and equipment approved by Health Canada, but there's little oversight.
Who's in charge, Albert, of all of these private testing companies?
Well, no one. And that's got some people very concerned. Private testing is a largely unregulated industry. There's no central licensing body. No one is actually tracking how many tests are being done by private companies. And that is so important because it can affect the positivity rate, which is often relied on to figure out where outbreaks might be happening.
Today's information comes to us by way of an access to information package from the CBC. Today, I'll show you email after email of CBC officials looking for private healthcare options for COVID testing while running story after story after story to sow public distrust and mistrust in private COVID testing. It's unreal, but it's true. Let me show you. Starting on page 2, the CBC was looking to set up a private testing COVID center for their film crews who would be traveling outside of Canada. They were working with MCI medical clinics outside of Quebec. And this is back in August of 2020. Here's the email. Hi, Genevieve. Wednesday, August 26, 2021 at 11 a.m. We need to set up a private testing option for our film crews that are starting to travel again outside of Canada, but must have a negative COVID test within a certain time frame before being able to travel. That's weird. Private healthcare for the CBC? Now on page 6, they're planning for the same thing, but for vaccines, again with MCI Medical, a private healthcare company. Look at this. Same people talking. Thanks, Genevieve. Do you have a document with all your locations in it across Canada? It may be easier to link to that instead of just showing the Toronto locations. I don't want it to look like you only have locations in Toronto. I can use the same document then for the vaccines process. Well, the government state broadcaster here is tacitly acknowledging, without an ounce of self-awareness, that perhaps private industry, private business might be more efficient at certain things than the government? Well. On page 12, it says, I was under the impression that you cannot get tested privately and they need to use the Canada Health testing facilities and then wait the required number of days. Can you confirm this is correct? Or if there is an alternative private option that we should consider? Doesn't the CBC normally call this sort of thing jumping the queue for private healthcare service? I'm pretty sure they're against that kind of thing. Now on page 20, CBC will not publish their protocol for the private testing, although it's literally listed here as well. They will use private testing when convenient, basically instead of lining up for hours. On page 27, they want travel providers to book them rooms in the quarantine hotels so CBCers don't have to wait on hold like normal people do for hours and hours. Look at this. In addition to the questions around support for testing, finding clinics, is there a way for our existing travel provider to assist with booking the government-approved hotel rooms as opposed to having our staff wait on hold for many hours? Yeah, we wouldn't want them to be treated like normal people. Then CBC decides they need to know the health status of their employees. What a bunch of completely invasive weirdos. Anyway, page 32. Without exception, You must advise your manager if you get tested for COVID-19, whether voluntarily or after being contacted by public health authorities and told to self-quarantine for 14 days. On page 43, it reads, "We are suspending all non-essential business travel, including travel within Canada and international travel. All exceptions will require a higher level of approval depending on the type of travel." You know, unless you're the CBC president, right? Did you know that the CBC president, Catherine Tate, travels back and forth across the border because she actually lives in New York with her husband? Now, here's the article in case you missed it. In True North, CBC president running company from multi-million-dollar Brooklyn mansion. Yes, indeed. Sources told Canadaland that Tate took a secondary residence in Ottawa as a condition of her position at the CBC. Despite coronavirus-related travel advisories and border restrictions, Tate spent April and May in New York before flying back to Canada on June 8th. Tate returned to Brooklyn on November 13th, where she continues to oversee Canada's public broadcaster. Ms. Tate did not receive any special exemptions from the government for her travel, said CBC spokesperson Chuck Thompson. Official CBC COVID-19 policy prohibits all non-essential work travel in accordance with federal health orders. And about a month after that news broke about Catherine Tate, this story here was in the National Post. Yet another CBC executive skirting the lockdown they want the rest of us to live under. Head of Radio Canada spent month of December in his Miami condo despite public health warnings. On the day Bissonnette arrived in Florida, Miami-Dade County reported 9,890 new COVID-19 cases, according to the U.S. Centers for Disease Control and Prevention. Now, on page 44 of these documents, it reads, as instructed by the Government of Canada, we strongly recommend that you refrain from traveling abroad. Again, I guess, unless you're the CBC president or the head of Radio Canada. On page 47, it reads, even in regions where face masks or face coverings are not mandatory, we highly recommend employees wear a 3-ply mask at all times whenever possible in our workplaces. Even when you wear a mask, you must strictly adhere to good hygiene and public health measures, including frequent hand washing and social distancing. Now, on page 53, we also see that CBC wanted to be treated like cops, frontline healthcare workers, and firefighters. They wanted to get access to vaccines ahead of the general public. It reads, will CBC Radio Canada employees have priority access to the vaccine? Essential Services designation. On page 55, it reads, once the vaccine is widely available, will we remove existing health and safety measures within our workplaces and in the field? The answer is no. So I guess that may be the only time CBC wants to impose on themselves what they wish and hope to impose on the rest of us. These never-ending behavioral restrictions, regardless of COVID status, the state of the pandemic, or even vaccination status. Remember all of this next time you're watching the CBC fearmonger to you about the state of Florida or private healthcare. They love those things for themselves, but they want you to be locked down and waiting in some sort of healthcare lineup ever and ever. For Rebel News, I'm Sheila Gunn Reid. Let's be real here. At $1.5 billion subsidy dollars every single year, the CBC is an arm of the government. So the CBC is not necessarily going to investigate the government and bite the hand that feeds them, but they're certainly not going to tell the truth about themselves and how they spend the tax dollars you give them. That's why it's essential that we at Rebel News do these sorts of access to information investigations. However, unlike the CBC, we don't get $1.5 billion to ask questions nobody wants to hear the answers to anyway. We want to ask real hard questions of the government. However, these sorts of access to information investigations do take time. They do cost money to file the documents, to go through the documents, to appeal the redactions that we often get. If you can help us fund our access to information investigations, please go to rebelinvestigates.com.